Depression is a complex and multifaceted mental health condition, and various theories attempted to explain its causes and underlying mechanism. While there isn't a single universal theory proposed by a specific individual that outline how to overcome depression, several therapeutic approaches and techniques have been developed by various psychologists and researchers to address and manage depression. These approaches are often based on different theoretical frameworks and empirical evidence. Some common therapeutic approaches to overcoming depression are: Number 1. Cognitive behavioral therapy. This was developed by R&T back in the 1960s. He noticed that his patients' thought patterns significantly influenced their emotions and behaviors. He found that he could help alleviate their symptoms by challenging and changing these negative thought patterns. It is one of the most widely used and effective treatment for depression. It is based on the cognitive theory of depression and focuses on identifying and challenging negative thoughts, patterns, and beliefs that contribute to depression. It also includes behavioral strategies to help individuals engage in positive activities and develop healthier coping mechanisms. Number 2. Interpersonal therapy. It was initially developed by Gerald Klerman and Marna Weisman in the 1970s. It was designed as short-term therapy to address interpersonal issues and improve social functioning, particularly for depression. It addresses how difficulties in relationships and life transitions can contribute to depression and aims to improve communication, problem solving, and support systems. Number 3. Mindfulness-based cognitive therapy. It was developed by Zindel Segal, Mark Williams, and John Teasdale. It combines elements of cognitive behavioral therapy with mindfulness practices to help individuals with recurrent depression prevent relapse. It helps individuals become more aware of their thoughts and feelings without judgment and aims to prevent relapse in individuals with recurrent depression. Number 4. Acceptance and commitment therapy. It was developed by Stephen Hayes, Clay Wilson, and Kirk Stossel. It incorporates principles of mindfulness and acceptance to help individuals develop greater psychological flexibility and commitment to their values. It encourages individuals to accept their negative thoughts and emotions while committing to take positive action towards their values and goals. It aims to reduce the struggle with distressing thoughts and foster psychological flexibility. Number 5. Behavioral activation. It's a component of various therapies and focuses on increasing engagement in positive and rewarding activities to counteract the lack of motivation and pleasure often experienced in depression. Number 6. Positive psychology intervention. These interventions focus on enhancing positive emotion, strengths, and well-being rather than solely targeting negative symptoms. They aim to promote positive functioning and resilience. It's important to remember that the effectiveness of these approaches can vary from person to person. What works for one individual may not work for another. If you or someone you know is experiencing depression, seeking help from a qualified mental health professional is crucial. They can provide a thorough assessment and recommend the most appropriate treatment approach for the specific situation. Additionally, they can provide ongoing support throughout the recovery process.